breathable underwear. Well, how would I know?
Pure cotton rather than
pure
synthetic.
cotton is the safest. Okay, got it.
Okay.
Hello and welcome to another episode of Ask Me Doctor, brought to you by motherhood.com.my. I'm your host Alisa Sarah, and today we have Dr. Nicholas Lim, consultant and obstetrics and gynecology, to talk about how probiotics promote vaginal wellness. So thank you so much for joining us today.
It's my pleasure. Thank you for having me.
Yes, of course. We have a lot of questions to ask you today. So let's start with some background information. Can you tell me about the importance of vaginal health and why it's important for women to pay attention to it?
Did you know that vagina is a self-cleansing organ? But because of hormonal change, irritation or other lifestyle factors, it may negatively affect the vaginal health, causing infections and other issues.
I see.
During pregnancy, if required, medications such as antibiotics may be prescribed, but it may kill off both good and bad bacteria.
Right.
So it is advisable to supplement the probiotics during and after a course of medication.
So you mentioned about preventing infections and other issues. Can you elaborate a bit more on that?
Okay. Vaginal infections that happen during pregnancy are caused by changes in hormones, the pH of the vaginal fluid, and even a drop in immunity. Pregnancy-related vaginal infections include bad bacteria overgrowth, causes bacterial vaginosis. Itching, burning, and a strong fishy smells are symptoms. Candida infection or overgrowth causes yeast infections. Itching, burning, and thick white discharge are symptoms. Group B streptococcus, or better known as GBS, affects 20 to 30% of mothers. Most of them are unaware of it. Screening done roughly around 36 weeks of pregnancy, and antibiotics are usually given if needed as discussed. If not, GBS can be transferred to infants during delivery and cause the baby to have serious health problems.
Okay, that sounds scary.
Pregnancy can increase the risk of urinary tract infection, or better known as UTIs, because during pregnancy, hormonal changes can affect the urinary tract and make it easier for bad bacteria to grow.
I see, so that's why. So earlier, you did mention about 4 types of infections, which are bacterial vaginosis, yeast infection, GBS, and UTI. So how do we treat these infections?
Probiotics can also help to prevent and treat vaginal infections, such as BV, bacterial vaginosis, and yeast infections. BV occurs when there is an overgrowth of harmful bacteria in the vagina, leading to an imbalance in the vaginal microbiota. Studies have shown that probiotics containing 𝗘𝗣𝗜𝗔𝗪𝗔𝗬 rhamnosus and 𝗘𝗣𝗜𝗔𝗪𝗔𝗬 reuteri have been shown to prevent the infections or to reduce severity of the infections. Left untreated, some vaginal infections can lead to more serious infections and can even cause preterm labor.
Oh, wow.
That is something that it's very dangerous.
That's quite worrying.
Treatment typically involves antibiotics that can be used during pregnancy as prescribed by your doctor. It is suggested to take along with probiotics during and after treatment to replenish and sustain the good bacteria for better urogenital health. Yet some medications are unsafe. So I prescribe probiotics that safely restore vaginal microbiota balance and health without negative effects.
So that's kind of good. Prescribed safe probiotics, right? Especially for pregnant women.
You kill off some, you grow some.
So I do have another question for you. How can women incorporate probiotics into their vaginal health routine?
Okay, very good question. There are a few ways we can take probiotics, but usually it is generic strains and found in food that are not often consumed by many. One way is to eat probiotics-rich food like yogurt, kefir, and pickles and kimchi. Oh,
really? I actually love kimchi, so thank God that's like a benefit for me.
Yes. Okay, another way is either taken orally or by tablets insertion.
Right.
Oral method is non-invasive and similarly effective. You may also consult your doctor about it.
Okay.
How oral-vaginal benefiting probiotics work is that it will travel naturally to the vagina by natural colonization and ascension. The probiotics will survive the entire GI tract and migrate to the preferable environment, which is the urogenital system.
I see.
It helps with 1. Reduce inflammation, maintain healthy pH, restore vaginal microflora, provide antimicrobial activity, and prevent the growth of bad bacteria that cause urogenital problems.
Wow, that's actually a lot of benefits, doctor. And I do have to agree with you because when I had some discomfort in my vagina during pregnancy, my ONG recommended me to take BiO-LiFE Proutix to help manage the situation. Are there any risks or side effects associated with using probiotics for vaginal health?
For the most part, probiotics are considered safe and don't have any significant side effects.
Alright.
However, some women may experience mild discomfort or irritation when using tablet insertion.
Oh, really?
Yeah.
I didn't know that.
Therefore, we recommend oral intake feminine health probiotics.
So oral is always better than tablets.
Well, it's less
right?
invasive.
Okay, less invasive, correct.
It's also important to note that not all probiotics are made the same. So it's important to choose only selected clinically proven probiotics targeted for your health concern.
Okay.
And I know some women are concerned about odor. Probiotics can also help reduce vaginal odor and discomfort, which can be caused by an imbalance in the vaginal microbiota.
Okay, that's actually really good to know.
Yeah. So by restoring a healthy balance of bacteria, probiotics can help alleviate these symptoms.
Are there any other tips or advice you would have for women who want to maintain good vaginal health?
Definitely. In addition to using probiotics, women should practice good hygiene, wear breathable underwears, and avoid too tight clothing.
Breathable underwear. Well, how would I know?
Pure cotton rather than
Pure
synthetic.
cotton is the safest. Okay, got it.
Okay, they should also talk to their doctor about any concerns they have and get regular gynecological exams or checkups to catch any potential issues early on.
How often should the checkups be?
Well, I'll recommend it an annual checkup.
Annual, okay.
If there's no issues.
So is there anything else you'd like to share with us?
My final message will be for all preggy mummies out there. Probiotics are important for you. Oral feminine health probiotics can be non-invasive, natural and sustainable way to treat or prevent vaginal infections for a long time, especially for pregnant women who are more likely to get yeast infections. With healthier microflora in the womb, the microflora passed down to the baby during delivery will also be healthy probiotics.
So you heard it from the doctor. Remember, mommy's healthy womb for a healthy baby. So thank you so much for your time and your expertise, doctor.
You're most welcome, Aliza. I appreciate you taking the time to listen, and I sincerely hope that you found my insights to be helpful.
Of course, it's an honor to be talking to you, and I really hope the viewers out there enjoyed the show that we had today. So don't forget to join our contest to stand a chance to win a Motherhood AMD Wellness Box and a limited time voucher to redeem BiO-LiFE Proutix in store. All you need to do is step 1, answer this question. Name one type of vaginal infection. Step 2, tag 3 friends and share this post. Make sure that your account is in public mode so that we can see your lovely submissions. And special thanks to BiO-LiFE Proutix, clinically proven women's probiotics for better urogenital health, for sponsoring this episode of Ask Me Doctor. BiO-LiFE providing a wide range of targeted probiotics for different health concerns. We believe probiotics for life. Thank you so much for watching, and we'll see you again next time. I'm Aliza Sarah.
I'm Dr. Nicholas Lim.
And this is motherhood.com.my. Bye!
Bye!